Have you ever felt this way? You read health advice online and walk away more confused than protected. One of my patients once shared this with me. She looked at me and asked, "Doctor, what actually protects me?" I want you to imagine this. Standing in a quiet room with clear instructions instead of noise, knowing exactly what helps and what does not. I am Dr. Evelyn Carter, and I have spent decades caring for older adults across the United States. Over the years, I have seen how easily fear can slip into conversations about prevention. Many people come to me overwhelmed by advice they found online. Wash this, avoid that, try everything. Most of it sounds urgent, yet very little of it explains what truly works in real life. That is why today we are talking about Nipah virus prevention in a calm and practical way. Prevention is not about living in constant worry. It is about understanding behavior and context. It is about knowing which everyday choices actually reduce risk and which ones simply create stress. When advice is rooted in fear, it often leads people to do too much or nothing at all. Neither approach protects health. From a simple scientific perspective, effective prevention focuses on how exposure happens and how the body responds. It does not rely on extreme measures. It relies on clarity, consistency, and trust in proven guidance. This matters especially for older adults, because prevention should support daily life, not disrupt it. I often remind my patients that good prevention feels steady, not frantic. It fits into routines. It respects the body's need for balance. When people understand this, they stop chasing every new warning and start making thoughtful choices that truly protect them. At Senior Health Daily, my goal is to give you information that feels grounding and usable. If this kind of calm explanation feels helpful, please take a moment to like this video, share it with someone you care about, and subscribe to Senior Health Daily. Your support helps us continue creating clear, trustworthy health guidance made especially for you. In the next part, we will look closely at how Nipah virus prevention actually works and why understanding real risk makes all the difference. Understanding how Nipah virus spreads. To understand what actually protects you, we first need to slow down and talk about how Nipah virus spreads in real life. Prevention always begins with understanding exposure. Without that clarity, advice becomes vague and fear fills the gaps. In my years of practice, I have noticed that many people imagine viruses as something floating freely in the air, ready to reach anyone at any time. Nipah virus does not work that way. Its spread depends on specific situations and specific contacts. This is important because when risk is specific, prevention can also be specific and practical. Nipah virus is known to move from animals to humans under certain conditions. Most often, this involves close contact with infected animals or materials contaminated by them. It does not spread casually through everyday social interactions like shopping, walking outside, or sitting with family. That distinction alone removes a great deal of unnecessary worry. I remember a patient who avoided leaving her home after reading about Nipah virus. She believed that simply being in public put her at risk. When we talked through how transmission actually occurs, her anxiety softened. She realized that her daily routines were not the problem. What mattered was understanding where real exposure could happen and where it could not. From a simple scientific perspective, viruses need a pathway. They do not appear randomly. They move through contact, fluids, or environments that allow them to survive. For Nipah virus, those pathways are limited and well studied. That is why public health guidance focuses on targeted prevention rather than broad restrictions. This is where many online recommendations go wrong. When people do not understand transmission, they may take extreme measures that offer little protection while increasing stress. True prevention is not about doing more. It is about doing what aligns with how the virus behaves. For older adults, this clarity is especially valuable. The body responds better when the mind feels safe. Constant fear can weaken routines and disrupt sleep, appetite, and balance. Understanding real risk supports both emotional and physical health. Caregivers and families also benefit from this foundation. When everyone shares the same clear understanding, conversations become calmer. Decisions feel grounded rather than reactive. That shared calm is protective in itself. Understanding how Nipah virus spreads is not about memorizing details. It is about perspective. When you know where risk exists and where it does not, prevention becomes manageable. It fits into life instead of overtaking it. This foundation allows everything else we discuss to make sense. When you understand transmission, you can evaluate advice wisely, choose precautions confidently, and release fear that does not serve you. That is why this understanding is the first and most important step in learning what actually protects you. Prevention myths versus proven measures. Once people begin to understand how Nipah virus spreads, the next challenge is sorting through the many prevention messages they hear. This is where myths often take hold. In my experience, misinformation rarely comes from bad intentions. It usually grows from fear mixed with incomplete understanding. When people want to protect themselves, they may cling to advice that sounds reassuring, even if it is not supported by evidence. One common myth is that extreme isolation is the safest form of prevention. Some people believe avoiding all public spaces or limiting contact with others will keep them safe. For Nipah virus, this approach does not match reality. The virus does not spread through casual community contact. Extreme isolation may increase stress and loneliness without providing meaningful protection. Proven prevention focuses on avoiding specific exposures rather than withdrawing from daily life. Another misunderstanding is the belief that frequent disinfecting of everything at home is essential. While basic hygiene is always helpful, excessive cleaning aimed at Nipah virus prevention offers little benefit if there is no exposure pathway present. This kind of advice often creates anxiety and fatigue. It shifts attention away from what actually matters and toward actions that feel busy but are not protective. I have also heard patients ask whether taking supplements or special remedies can prevent infection. This is a very human response. People want something simple they can control. At this time, there is no supplement that prevents Nipah virus infection. Proven measures focus on behavior and awareness, not quick fixes. So what does evidence-based prevention look like? It begins with understanding exposure. Avoiding contact with potentially infected animals or materials is key. Following public health guidance when traveling or living in regions where the virus has been identified is another proven measure. These recommendations come from careful study, not guesswork. Proven prevention also respects proportion. It does not ask people to live in fear. It asks them to stay informed and make thoughtful choices when relevant. This balance is important for older adults. Overly strict rules can disrupt routines that support strength, balance, and emotional well-being. I often tell patients that good prevention feels reasonable. It fits into life rather than overtaking it. When advice feels overwhelming or urgent without explanation, it is worth pausing and asking where it comes from. Reliable guidance explains why a measure works and when it applies. Comparing myths with proven measures helps restore confidence. When people let go of unnecessary actions, they make room for clarity. Prevention becomes calmer, simpler, and more effective. For seniors and caregivers alike, this distinction is empowering. It replaces confusion with understanding. It allows people to protect themselves without sacrificing peace of mind. That is what effective prevention is meant to do. Everyday safety precautions that matter. When prevention is discussed online, everyday habits are often either ignored or exaggerated. In reality, the most protective actions are usually simple, consistent, and realistic. They do not demand fear or constant vigilance. They support health quietly in ways that fit into daily life. In my practice, I have seen that people feel safest when prevention aligns with how they already live. For Nipah virus, everyday safety is not about drastic change. It is about awareness in the right moments. This begins with respecting guidance related to animals and food sources in areas where the virus has been identified. Avoiding direct contact with sick animals or unfamiliar wildlife is a sensible habit that protects against many infections, not just one. Hand hygiene is another example. Washing hands at appropriate times supports overall health, yet it does not need to become obsessive. Normal routines before eating, after being outdoors, or after handling animals are sufficient. Excessive cleaning can increase stress without adding meaningful protection. Balance matters. I often remind older adults that safety precautions should feel supportive, not restrictive. When habits become extreme, they can interfere with movement, social connection, and rest. These are all essential for healthy aging. True prevention respects the whole person, not just the idea of avoiding illness. Food awareness also plays a role. Choosing foods from reliable sources and handling them properly is a practical habit. There is no need to fear everyday meals or avoid normal foods. Sensible preparation and storage are enough. When people understand this, they stop second-guessing every bite and start enjoying nourishment again. Another important habit is staying informed through trusted sources rather than constant scrolling. Limiting exposure to alarming content helps the nervous system remain steady. When the mind is calm, people make better decisions. This is especially important for seniors, whose balance and focus can be affected by stress. From a medical perspective, consistency is more protective than intensity. A steady routine practiced over time supports the immune system and overall well-being. Sudden changes driven by fear can disrupt sleep, appetite, and emotional health. I have watched patients regain confidence simply by returning to reasonable habits. They stop chasing every warning and start trusting what they know. That trust is powerful. It allows prevention to blend into life rather than dominate it. Everyday safety precautions that matter are the ones you can maintain without strain. They are grounded in awareness, not alarm. They protect health while preserving quality of life. When prevention feels calm and doable, it becomes sustainable. And sustainability is what truly protects over time. Preventing exposure without changing your life. One of the most important messages I want older adults to hear is this. Prevention does not mean living in fear. It does not require giving up routines that bring comfort, purpose, and connection. In fact, the most effective prevention often works best when life stays familiar and steady. I have met many patients who believed they had to dramatically change their lives to stay safe. Some stopped seeing friends. Others avoided simple pleasures like walking outside or visiting family. Over time, this kind of fear-based prevention caused more harm than protection. Loneliness increased. Sleep suffered. Confidence declined. None of these outcomes support good health. Preventing exposure to Nipah virus is about understanding where risk truly exists and where it does not. For most people, daily activities carry no meaningful risk. Going to the grocery store, attending community events, or spending time with loved ones does not increase exposure. When people understand this, they begin to relax back into their routines. Familiar rhythms matter deeply, especially as we age. The body thrives on predictability. Regular meals, gentle movement, social connection, and rest all support immune function and emotional balance. Disrupting these rhythms in the name of prevention can weaken resilience rather than strengthen it. From a clinical perspective, I often see that patients who maintain normal routines recover faster from stress and illness. Their bodies know what to expect. Their nervous systems remain calmer. Prevention that honors routines supports the whole person, not just one potential risk. This does not mean ignoring guidance. It means applying it wisely. If certain environments or situations are identified as higher risk, adjustments can be made thoughtfully and temporarily. There is no need to generalize that caution to every part of life. Precision matters. I encourage older adults to ask a simple question when faced with advice. Does this help me live better? Or does it make me withdraw? If the answer is withdrawal, it is worth pausing. Good prevention should feel empowering, not limiting. Caregivers and family members also play a role here. Reassuring conversations help loved ones stay engaged with life. Gentle reminders that safety and normalcy can coexist restore confidence. Fear often grows in silence. Calm explanation brings it back into proportion. Preventing exposure without changing your life is about trust. Trust in your routines. Trust in your ability to make thoughtful choices. Trust in systems designed to monitor risk so you do not have to carry that burden alone. When prevention is woven into daily life, rather than placed on top of it, people feel steadier. They sleep better. They move more freely. They enjoy the moments that matter. That balance is not only healthier, it is also sustainable. Why older adults need tailored prevention? Prevention does not look the same at every stage of life. What works well for younger adults may not always be appropriate or helpful for older adults. This is not a weakness. It is simply a reflection of how the body changes with time and experience. Understanding this difference allows prevention to be respectful, effective, and sustainable. As we age, the body becomes wiser but also more sensitive. Balance, energy levels, and recovery time shift gradually. The immune system continues to protect us, yet it often responds more slowly to stress. Because of this, prevention for older adults must focus on stability rather than intensity. Extreme measures can create strain that outweighs their benefit. In my years caring for seniors, I have seen how well-intentioned advice can sometimes miss this point. Telling an older adult to radically change routines, avoid social contact, or follow rigid rules can increase anxiety and disrupt daily rhythm. These disruptions affect sleep, appetite, and movement, all of which are essential to staying well. Prevention that ignores these realities does not truly protect. Tailored prevention respects the body's pace. It works with existing habits instead of against them. For example, maintaining regular movement through familiar activities supports circulation and confidence. Preserving social connection supports emotional health and cognitive clarity. These elements strengthen resilience in ways no extreme precaution ever could. Older adults also benefit from prevention that is clearly explained. When people understand why a measure is recommended and when it applies, they are more likely to follow it calmly. Vague warnings create worry. Specific guidance builds trust. This trust allows prevention to feel like support rather than restriction. From a medical perspective, consistency matters more than perfection. A steady routine practiced daily protects the body better than occasional bursts of strict behavior. This is why tailored prevention emphasizes balance. It acknowledges physical limitations while honoring independence. Habits carry meaning. They reflect a lifetime of experience. Asking someone to abandon them without reason can feel unsettling. Good prevention listens first. It asks what already works and builds from there. I often remind patients that their bodies have adapted through decades of change. Respecting that history is part of good care. Prevention should feel like an extension of self-care, not a reminder of vulnerability. When older adults receive guidance designed for them, confidence grows. They feel seen, respected, and capable. That confidence reduces stress, supports immune health, and encourages engagement with life. Tailored prevention is not about doing less. It is about doing what fits. When prevention honors the body and routines of older adults, it becomes something they can live with easily and trust over time. I want to pause with you here, not to shift the focus, but to acknowledge something meaningful. If you are still listening at this point, it tells me you care deeply about understanding your health in a calm and thoughtful way. That kind of attention matters. It is not passive. It is a form of self-respect. Over the years, I have learned that people often arrive at channels like this during quiet moments. Sometimes it is after hearing advice that felt confusing or overwhelming. Sometimes it is because they want reassurance that they are doing enough without doing too much. These moments are personal, and they deserve a gentle response rather than pressure. Senior Health Daily was created for exactly this reason. It is meant to be a steady place, a place where information is shared slowly, with care, and with respect for the life experience you bring with you. Health education should never feel rushed or demanding. It should feel like a conversation where you are heard. I often think about caregivers and family members as well. Many of you are listening not only for yourselves, but for someone you love. You want to support them without causing worry. You want guidance that helps you stay calm so they can stay calm too. That shared steadiness is powerful. So I want to share this with you in a sincere and natural way. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. This invitation is not about numbers or algorithms. It is about community. When you subscribe or share, you help this kind of content reach others who may be searching for clarity instead of noise. You help ensure that thoughtful health conversations remain available to those who need them. Whether you choose to subscribe today or simply continue listening quietly, know that you are welcome here. Your presence matters. Your willingness to learn calmly is a strength. As we continue this discussion, I invite you to stay engaged in the way that feels right for you. Health is not something to rush through. It is something to walk through with patience, understanding, and support. That is what this space is here to offer. Can Nipah virus truly be prevented? This is one of the most common and honest questions I hear. Can Nipah virus truly be prevented? The simple answer is that prevention in medicine is rarely about absolute control. It is about reducing risk in meaningful and realistic ways. When we understand that difference, the conversation becomes much calmer and more empowering. In science, prevention is defined by probability, not certainty. We look at how likely exposure is, how transmission occurs, and what behaviors reduce that likelihood. With Nipah virus, prevention focuses on interrupting known pathways rather than eliminating every possible risk. That distinction matters. It means people can live their lives while still being protected. I often explain this using everyday examples. Wearing a seatbelt does not guarantee safety in every situation, but it significantly lowers the chance of serious injury. We still drive. We do not stop living. Prevention works the same way with infections. Thoughtful actions lower risk without demanding perfection. For Nipah virus, the most effective prevention comes from understanding where exposure is possible and avoiding those specific situations. This includes limiting contact with sick animals in regions where the virus has been identified and following guidance provided by public health authorities when relevant. These measures are targeted. They are not meant for constant use everywhere. Some people feel uneasy when they realize prevention is not absolute. They want certainty. I understand that feeling, especially among older adults who value stability. But in medicine, chasing certainty often creates stress without improving safety. Accepting reasonable protection allows the nervous system to relax and routines to remain intact. From a scientific standpoint, the body also benefits from this approach. Chronic anxiety can weaken immune response over time. Calm confidence supports overall health. When prevention feels manageable, people are more likely to follow guidance consistently, which is far more protective than short bursts of extreme behavior. I have seen patients feel relieved when they understand this. They stop asking whether they are doing enough and start asking whether what they are doing makes sense. That shift is powerful. It turns prevention into a supportive practice rather than a source of worry. Public health systems are designed to handle the parts individuals cannot control. They monitor trends, study changes, and respond when needed. This allows individuals to focus on their own well-being without carrying the full weight of responsibility. So can Nipah virus be prevented? It can be managed thoughtfully. Risk can be reduced effectively. Life can continue with confidence. Prevention does not mean eliminating uncertainty. It means respecting reality and choosing actions that protect without overwhelming. When people understand prevention this way, fear loses its grip. knowledge becomes practical, confidence grows, and health becomes something you support daily, not something you constantly worry about. The role of public health prevention. When people think about prevention, they often picture personal choices alone: what they eat, where they go, what they avoid. While individual actions matter, they are only one part of a much larger protective system. Public health prevention exists so that no one has to carry the full responsibility by themselves. Public health works quietly in the background. Teams of professionals monitor patterns, study data, and share information across regions and countries. This includes watching animal health, environmental changes, and unusual illness reports. When something shifts, they do not panic. They verify, compare, and decide whether guidance is needed. Most of the time, no action is required, and life continues uninterrupted. That quiet success is the goal. I often tell patients that public health is like the foundation of a house. You do not see it every day, but it supports everything above it. When the foundation is strong, the home feels stable. When systems are working well, individuals can focus on living rather than worrying. For Nipah virus prevention, public health measures include surveillance, education, and coordination. These systems identify where risk may exist and provide targeted guidance to those who need it. This prevents broad restrictions and unnecessary fear. It also ensures that advice is based on evidence rather than speculation. Older adults sometimes feel pressure to do everything right, as if one mistake could put them in danger. This belief can be exhausting. It is important to understand that prevention is shared. Public health systems are designed to reduce risk at a population level so individuals can make reasonable choices without constant vigilance. From a medical perspective, this shared responsibility is essential. No single person can monitor global trends or predict changes. That work belongs to trained professionals and institutions. When individuals trust these systems, stress decreases and adherence improves. People are more likely to follow guidance when it feels supportive rather than demanding. I have seen how relief settles in when patients realize they are not alone in prevention. They stop feeling like they must anticipate every risk. Instead, they learn to respond calmly when guidance is relevant to them. This shift protects mental and physical health. Public health prevention also evolves. It learns from past experiences and adapts. This flexibility allows systems to improve over time while remaining measured. It is not about control. It is about coordination. Understanding the role of public health helps people place their own actions in context. You are not expected to manage everything. You are expected to stay informed, follow guidance when it applies, and live your life with balance. When individuals and public health systems work together, prevention becomes steady and effective. Responsibility is shared, fear is reduced, confidence grows. That partnership is one of the strongest protections we have, especially for older adults who deserve clarity, support, and peace of mind. How to evaluate health advice wisely. As health information becomes easier to access, the challenge is no longer finding advice. It is deciding what deserves your attention. For older adults, this decision matters because not all information is created to inform. Some of it is designed to provoke fear, urgency, or clicks rather than understanding. A helpful place to begin is by noticing the tone of the message. Advice that relies on fear often uses strong language without explanation. Words like urgent, hidden, or shocking can create anxiety before facts are presented. Wise health guidance feels different. It explains why something matters, who it applies to, and what actions are reasonable. When explanation is missing, caution is warranted. I often encourage patients to ask a simple question. Does this advice help me understand, or does it make me feel afraid? If fear is the main response, the information may not be serving your health. Fear narrows thinking. Understanding opens it. This distinction is especially important as we age, when stress can affect balance, sleep, and concentration. Another useful practice is checking the source. Advice connected to established medical organizations, public health agencies, or experienced clinicians tends to focus on evidence rather than emotion. Reliable sources acknowledge uncertainty and explain limits. They do not promise perfect protection or dramatic outcomes. They offer guidance that fits into real life. Older adults also benefit from slowing the intake of information. Repeated exposure to the same message across different platforms can magnify its emotional impact without adding clarity. Choosing one or two trusted sources and checking them occasionally is often enough. More information does not always mean better understanding. Context matters as well. Ask whether the advice applies to your situation. Many health recommendations are meant for specific regions, exposures, or populations. When guidance is shared without context, it can feel more relevant than it actually is. Clarifying relevance reduces unnecessary worry. Conversations help bring perspective. Talking with a family member, caregiver, or healthcare provider allows questions to surface and assumptions to be gently corrected. Spoken aloud, fears often lose their intensity. Shared understanding restores balance. From a medical standpoint, the goal of advice is to support health, not dominate attention. When guidance aligns with that goal, it feels steady and reasonable. When it does not, it often demands constant vigilance. Learning to evaluate health advice wisely is a skill. It improves with practice and patience. For older adults, this skill protects emotional well-being as much as physical health. By choosing information that explains rather than alarms, you create space for calm decisions, steady routines, and confidence in your ability to care for yourself. Living confidently with preventive knowledge. When prevention is understood clearly, something important changes inside the body and the mind. Worry gives way to confidence. Actions feel intentional rather than reactive. Prevention stops being a source of tension and becomes a quiet form of reassurance. I have seen this transformation many times. Patients who once felt overwhelmed by health advice begin to move through their days with greater ease once they understand what actually protects them. They stop scanning for danger and start trusting their routines again. This trust is not careless, it is informed. It comes from knowing where risk truly exists and where it does not. Preventive knowledge works best when it supports daily life instead of interrupting it. When older adults feel confident, they maintain movement, social connection, and regular sleep. These elements are essential to overall health. Stress-driven prevention often undermines them. Calm prevention strengthens them. From a scientific perspective, the nervous system responds to perceived safety. When the mind feels steady, the body functions more efficiently. Heart rate stabilizes, sleep improves, balance and focus become more reliable. Confidence is not just emotional, it is physical. Living confidently with preventive knowledge also means knowing when to step back. Not every headline requires action. Not every piece of advice applies to every person. Understanding this allows individuals to remain engaged without becoming consumed. Awareness becomes a background presence rather than a constant demand. I encourage older adults to view prevention as a partnership. You do your part by staying informed and making thoughtful choices. Public health systems do their part by monitoring risks and providing guidance when needed. This shared responsibility allows life to continue with balance and dignity. Caregivers often notice the difference when confidence replaces fear. Conversations become calmer. Decisions feel less urgent. There is more room for patience and kindness. These qualities support health in ways no checklist ever could. Living confidently does not mean ignoring reality. It means meeting reality with understanding rather than tension. Prevention then becomes something you carry lightly. It does not weigh you down. It supports you quietly. As this section comes to a close, I want to remind you that knowledge is meant to empower, not burden. When prevention is rooted in clarity, it creates space for living well. You remain proactive without being tense. You stay aware without being afraid. That balance is the true goal of prevention. It allows you to move forward with confidence, grounded in understanding, and supported by systems designed to protect without disrupting the life you have built. As we come to the end of our time together, I want to thank you sincerely for staying with me through this conversation. Choosing to listen calmly and thoughtfully is an act of care for yourself, and it matters more than you may realize. Today we talked about prevention not as something driven by worry, but as something guided by understanding. Effective prevention grows from knowing what truly protects you, not from fearing every possibility. When knowledge is clear, the body relaxes. When the mind feels steady, decisions become simpler and more confident. I want to remind you of something important. Growing older does not mean living cautiously at the expense of freedom. It means living wisely, with trust in your experience and respect for your body. Your body has carried you through decades of change, adaptation, and resilience. It responds best when it is supported, not pressured. Patience with yourself is a form of strength. Living safely does not require constant vigilance. It allows room for joy, connection, and routine. Prevention, when understood properly, fits quietly into life, rather than standing in its way. You can remain aware without being tense. You can be proactive without feeling confined. Senior Health Daily was created for moments like this, a place to return when health information feels overwhelming or too loud. A place where explanations are gentle, grounded, and meant to restore calm rather than urgency. You are always welcome here. If this conversation brought you reassurance or clarity, I invite you to continue walking with us. Stay connected with Senior Health Daily as a steady companion on your health journey. Together, we will keep choosing understanding over fear, patience over pressure, and confidence rooted in calm.